Hello, everyone, and welcome to our very first episode in a podcast series on immigrant health. My name is Arij. I'm a first year medical student at McGill. I'm also the local officer of IFMSC Quebec's Standing Committee on Human Rights and Peace. And today I'm very honored to have our first guest with us, Amar Farkou, who is also a first year medical student at Université de Montréal. In 2019, he received a very prestigious Laurent Scholarship, which is valued at around $100,000 in order to finance his studies in medicine. Every year, Laurent Scholars are chosen amongst thousands of applicants for their community engagement, leadership, and determination. Amar is also a Syrian refugee and he arrived here in 2016. So we will be discussing a bit more about his journey as well as his experiences with the healthcare system. So thank you so much, Amar, for being with us here today. How are you feeling?
Well, thank you at first for this introduction. I didn't know that you knew all this about me, but thank you for having me too and having this initiative. It's really a good idea, I think.
Thank you. Yeah, we do hope that students and people learn more about what it's like being a refugee and what it's like being a refugee interacting with the healthcare system. So let's get on it. First things first, can you tell us a bit more about your journey as a refugee?
Well, as you said, I arrived in Canada in February 16th, 2016, which was in the middle of winter. It was really cold. I've never experienced something like that in my whole life. But so now that makes it 5 years for me here. I have the citizenship. I passed the exam and the French tests and all these stuff. And yeah, that's pretty much it. I lived my whole life in Syria. Arrived here, I was 16 years old. Got into the French classe d'accueil, which is for francisation and to learn French and to learn the language. When I arrived here, I spoke Arabic, of course, my mother tongue, and I spoke English, but not a word in French. But I arrived to Sherbrooke, which is like an hour and a half from Montreal. And there, not speaking French was a big problem. Even speaking English, it was not part of the practice there. So I had to learn French. And yeah, it worked. That's it.
What would you say was like your biggest difficulty? Was it the language and like overcoming that barrier and getting to communicate with people? Was it like adapting to like the school system?
I think the main difficulty here in Canada was the language, especially for me being in Sherbrooke. Not knowing the language kind of gets you in your ego, in your own self, because you always knew how to express yourself. You always knew how to get the idea understood by the people who you're talking to, but then with the language, it couldn't work. And then for me, even more, because I always wanted to go to university and have a career in the health system. And knowing that I have this barrier, which is the language, and I have to overcome it and really quickly, because I'm 16, 17 years old. It's the age where you choose university, where you choose your path, you build your own path. There's also the fact that I left all my friends' life, the places where I lived and grew up in. We were only me and my parents who came here, so we have all our family there, my grandparents getting old and old.
Yeah, I can imagine. I'm also an immigrant, but I came here when I was a year and a half old, I think. So I don't remember much from it, but like from what my parents tell me and my older brother, yeah, it was difficult for them to get used to a whole new life where you're far away from your family.
Maybe I can add, seeing my parents here, seeing how much they sacrificed. I mean, yes, it's good for me and my brother who came here young, 16, 20 years old. But for them, they built their own life there. They built the whole career, and now there's this sense of responsibility that I feel towards my parents who sacrificed all this stuff for me.
And did you have like a sort of support system for you and your parents where you came here, like people from the community at Sherbrooke or even here in Montreal? Mm-hmm.
So when we came with this church. It was a really, really small community, small Syrian community, but it helped. It really, really, really helped because they helped us find a place to live in. They helped us with getting to know the paperwork, so especially for, I remember for the healthcare card for RAMQ and stuff. So yeah, having people really helped. But again, we don't have any family here, and even in Sherbrooke, we didn't know this community. It was difficult, but it was perfect having them there.
That's good to hear. What do you think you will take from this journey and like you being a refugee into your future medical career?
I think adaptability and maybe tolerance to uncertainty, because I can say maybe for refugees mostly, when you arrive to a new country, you don't have any idea what you're going into, or because I kind of compare myself to maybe an immigrant, an economic immigrant who basically did their research before coming to this country. They knew they were coming to Sherbrooke, to Montreal, to Toronto, etc. But for refugees, you simply don't know that much, and you don't know when you're gonna come, when they're gonna call you and say, tomorrow you have the medical test that you have to do in Lebanon, where I was, and then you have to come by a week. Your plane is there, and then you have to fly. So it's all uncertain, and you don't know what you're getting yourself into. But this is what I built up from this experience. I think I'm able to adapt more because I changed um, places where I lived a lot in my life.
Somebody once told me that medicine is basically having to live with the unknown. And I think that really captures what you went through. It's just not knowing where you might be the next day or like the next week or month or year and sort of adapting to that. So yeah. If we move on a little bit more to like your experience with the healthcare system, did you have any expectations about it when you first arrived? Like, and if you had, were they met? And if not, like how so?
For me and for maybe a lot of people who come from that region, the Middle East and maybe elsewhere, we always had this idea of the Western world, that they have really, really good healthcare systems. So my expectations were really, really high. So as long as my basic needs were there, it was simply okay. So I don't think I think my expectations were met and even more, because again, being a refugee, I think we only focus on basic needs, having a place to live, having being healthy, having food to eat, having electricity, having cold and warm water. So you see, these are the basic needs, and these were my basic expectations towards the healthcare system, and I think they were met.
And as you sort of like went through time and became more like adapted here and stuff, did your like expectations change as maybe like your medical needs or even entering the field of medicine, did those expectations change from like those having those basic needs met to like maybe something more complex?
They did. They did change because, as I said, when you get adapted to this society, you start seeing the loopholes and seeing the difficulties that an immigrant or a refugee can face upon arrival and getting inserted in the healthcare system. I think firstly would be adapting to the system, because not all healthcare systems are the same in around the world. For me, I find the healthcare system here in Canada really hospital centered. But for me, back in Syria, hospitals were the last place where you go just for really, really serious issues, surgeries, these big stuff. Because we had clinics, we had doctors coming to our home, and you see, the health system was totally different, and adapting to this system here is is something difficult because, as I said, I don't have this reflex of when I'm not feeling good and I don't have a family doctor. Coming to that point, I have to go to the hospital. It wasn't intuitive to me. Then you have the language barrier again, because I think the problem, I can summarize it up by saying that not having a family doctor, because family doctors here are kind of the solution of this type of healthcare system. But for immigrants, it's really, really, really rare to have a family doctor. I mean, it's been 4 years, 5 years for me now, and without knowing someone that I asked for, them asking their doctor to maybe get me and my family a family doctor, it wouldn't have happened. So not having a family doctor puts you in a position where you always have to explain to yourself and your situation to each doctor, and each time you see a new doctor in clinics or in a hospital, and not speaking the language and always feeling ashamed of your accent, of the way you speak, of not understanding, puts kind of a barrier there of, okay, I'm just going to push going to see a doctor really, really away because I don't want to deal with this right now.
And like in those instances where you did have encounters with like medical professionals at first, were there any like interpreters available for you and your family, like at the hospitals that you went to?
At first, because when we first arrived, we have some medical tests and screenings to do. We had the translators, I think they're called like that, but they came from an organization which was called the New Canadians in Sherbrooke. I think there should be someone in Montreal like that, but this organization offered and helped new immigrants that arrived to Sherbrooke to get the whole paperwork done. So each time that they took the appointments for screenings, for blood tests and stuff, and they gave an translator. But for when that part was gone, and then you had to deal with your own medical issues afterwards, there were not.
Okay.
Because usually there were, I mean, I remember I had to go to the emergency one time and I had to explain in English. That helped, and that really helped, but there were not always medical professionals who spoke English there too, or it was difficult. So I always had to have my phone and Google Translate always open.
And did you find that like sometimes these doctors or like medical professionals, did they try to make an effort to be accommodating and to like know that there's a language barrier between you? Were they like helpful in knowing that?
Yeah, I think they did. Especially, I remember this one doctor because I don't know if he was a pediatrician or I don't know who it was, but because I was under 18, so I remember him, and he really helped, and he even started using Google Translate and writing, I don't know, something in French and translating it to Arabic and like a word, and then I can hear it and say, okay, yeah, that's true, and I understand. Something that I can say, they were really, really helpful, kind, and smiley. they smile, they smile, and this helps. This really helps easing the communication between us, because I always felt as my ego was attacked and as I was reduced to maybe a baby, and I hated it. He didn't speak with me in a childish way. This helps a lot.
And so would you say like that's the most important things for like medical professionals when they do encounter immigrants or refugees, is to not treat them as children and as people like with full capacity? Yeah.
Exactly, because you have a whole background. I mean, this is for me, and I was 16, 17 years old. I think of my parents who have degrees and who have a life, who build a life, who build a society, and the way that you speak as when you want to be slow, which is you have to speak slowly because it helps understanding, but not in a childish way. This is something that should be taken into consideration.
Thank you. I think we can all like remember that for our future like interactions as medical students and as medical professionals down the line. So you mentioned that, not having a family doctor is really like one of the biggest hurdles for immigrants and refugees. What are the other ways in which one can like access healthcare services without necessarily having family doctors?
Well, there were the clinics, the sans rendezvous clinics. Again, these were good, but I didn't know they existed until I went on the internet, searched for how to see a doctor without going to the hospital in Canada. And then I found out about these clinics and the clinics on rendezvous and going to see a doctor there. But this happened after I started feeling competent in French, let's say. I think if I didn't get to that point, it was always going to be, I'm not feeling good seeing a new doctor each time. It's difficult explaining my situation each time and having to deal with Google Translate, with my ego, me turning red because I got shy and ashamed of not being able to speak and of my accent. And I mean, having this option is really, really good, but I think we have to take into consideration the fact that it's a barrier too, because changing the doctor each time isn't helping this this part of the community.
It's like starting all over again every single time.
Exactly, and having a family doctor, I mean, it would change everything, because even if they don't speak your language, even if they don't know anything about your culture, but again, seeing the same person multiple times, you get a sense of security there, and being kind of in a safe space with this doctor who knows about your situation, about your accent, about what you're ashamed of.
You're right. It does help. Would you say that, all these barriers we've been talking about, have they ever like prevented you from seeking care or like hesitated to like go see a medical professional?
Not hesitation, because when you have a medical issue, I think you have the urge of saving your life.
Yeah.
So when you have a medical issue, you go see a doctor. But it's not a hesitation, it's not knowing where to go. And the hesitation comes when you know where to go, but then again, all the barriers, your ego is attacked, language barrier, having to explain yourself multiple times, having to stay in the emergency room for what I remember once I went with my mother, it was at least 8 or 9 hours we stayed there. So after this experience, I was okay, I'm not doing that again. It was then when I Googled about the healthcare system in Canada and started looking about these clinics and stuff.
So like you said before, like you were delaying going to see someone just to like not have to go through that again.
Exactly, yeah. The family doctor system is really a good and adapted way for refugees and immigrants, because as I said, having the same person that you talk to each time, you become in a safe place with them. And I remember even for me back in Syria, we had this doctor who we asked him for everything, every issue, from pediatrics to eyes to anything. So you see, having this person, this reference that you seek help from them is something that helps you be more calm and more ready to speak with.
So as we've been discussing about all these barriers, and especially the fact that having a family doctor is so hard, are there any other areas that you think we can improve in the healthcare system to make it easier and better for immigrants and refugees?
Clinics, and making clinics more social, where you can go and you have your medical history, everything that relates to your medical situation, put in documents in this clinic. And this is like, it's like a family doctor, but a clinic for you, where a clinic, like a reference clinic, where you can go each time that you have a healthcare issue. This is I think it would be a solution, one of the solutions, because the best solution would be having family doctors for everybody. But I think even for some Canadians, they don't have family doctors. So I imagine for immigrants and new refugees, but maybe putting more money into clinics.
Yeah, it's true. Yeah. And just to like finish off, what advice would you give to medical students or future medical professionals about how to deal with like immigrants and refugees? What like advice would you give them, or like your peers right now in medical school? What would you say to them?
I would say don't treat them as victims. Maybe treat them more as equal humans, because I think this will lift up their idea of themselves in this society. And always have in mind that not all refugees and immigrants are the same. We're not proud of being a refugee. I never had the ability to speak and to introduce myself as a Syrian refugee, because I don't want to have the image that all the world have of a refugee. Maybe having this in mind, and even for, let's say, for the language. I mean, maybe this is gonna sound ridiculous, but for some people, when they come to the healthcare system, they like having a person that puts some words in their language. But for me, at first, I found it creepy sometimes to find someone who's from here, like, let's say a Canadian and maybe a white Canadian, and they put these words in Arabic, and I was, okay, I don't know. It felt creepy. It felt creepy sometimes. So you see, not all immigrants have the same idea and the same intentions and needs and things they like and they don't like. So always have the idea as diverse as your patients are, as diverse their way of thinking and the thing they love and they don't like too.
That's a good reminder that like we're all different and we have to treat each other like accordingly, and not treat like a whole population as like a monolith and just like put stereotypes on all of them, because that can be very harmful for their health in the end.
And maybe for the language part too, don't, again, as I said, speak slowly, but not in a childish way. This gets into the ego, even for adults, mature, anybody. And always have in mind that behind this person, behind this refugee that you see in front of you, there's a big background in his life. And maybe he was in war, maybe he was in a bad situation, but I'm pretty sure in a time in their life, they were living a good life.
That's a good closing statement. Would you like to add anything for our students listening to us today?
Well, I think I would say thank you. The only idea of you listening to this and trying to understand the situation of refugees and getting to know the history and the stories behind different communities that you're going to serve is a big step forward. As medical professionals, I think you have the obligation to do that, and you are doing it. So that's perfect.
Thank you. I do believe that as well, that as medical professionals, it is really our duty to seek to treat everybody as best as we can, even though their realities may be very different from our own, because at the end of the day, like, these are our patients and we have to take care of their health, and we can't let any like stereotypes or barriers or misunderstandings or like ignorance in the way of that, because then people are not healthy and it's on us. So yeah, thank you so much for joining us. This was really a pleasure getting to hear about your story and about your experiences. It was very enriching, and I'm sure it will be for everybody listening to this. So thank you, Amal, again so much. I wish you a very good rest of the night, and yeah, thank you so much.
Thank you for having me, and thank you for organizing this initiative.